Hello and welcome to this Cancer Grace webinar. My name is Bhisham Chera. I'm an associate professor in the Department of Radiation Oncology at the University of North Carolina School of Medicine in Chapel Hill, North Carolina. I'm also the associate chair for clinical operations and improvement and the director of patient safety and quality in my department. I have expertise clinically and academically in treating and doing research, treating head and neck cancer patients and doing research in the clinical field of head and neck oncology. I'm a radiation oncologist by profession. Next topic I want to talk about is how does your doctor determine if your head and neck cancer is related to HPV? I wonder, the biology of HPV is important to know for this topic. So E7 is a protein, a major oncoprotein created by the HPV virus, and what it does is that it basically grabs onto this retinoblastoma, which is a very important protein in the cell that regulates cell growth and division, and it destroys it. And when that happens, the cell compensates by creating more of this protein called P16. And P16's purpose in the cell is to slow down the cell division. So it's a reciprocal reflexive thing that the cell does when it's infected with the HPV virus. And this is important because this is important because the most common way to check for the human papillomavirus within your tumor is to actually check this protein, P16, which is not directly related to HPV, but is indirectly a surrogate marker for the presence of HPV infection and HPV activity in your cancer. So typically, there's two tests performed, but the most common test performed is this P16 test. So your physician typically gets a biopsy of what they're considering to be cancer, and this is sent to the pathologist. The pathologist, most pathologists will check for the P16 protein, which is where they put a stain on the cancer specimen, and here the stain is brown, means that there's P16 in these cells, and you can see that there's no brown here. This is the normal lymphoid tissue in the tonsil, and this is the cancer, and you can see it's staining diffusely brown, which implicates that this is P16 positive. And actually, they use a threshold. They want to see that greater than 70% positive staining of the sample to call the cancer P16 positive. And by calling this P16 positive, it is inferred that the virus is active in and associated with your cancer. One can also check for the actual virus itself through another different kind of test where they use a stain again, but this time the stain is showing HPV DNA in the cell, and this also can be done. Most often P16 is checked because it is a more reliable test and is easier to perform and has less false positives. There are situations where we do both tests and the HPV test is negative, but the P16 test is positive, and typically that is interpreted as we just missed the virus in the test wasn't accurate enough to find the virus, but because the P16 is positive, we really believe that it's there. We just couldn't find it. So P16 positivity is the most common way that we check for the human papillomavirus in your cancer specimen.